In previous videos on fungi, lecture number 1, we have discussed the general features of fungi, structure, classification, and all we have discussed. And in lecture number 2 on fungi, we have discussed the superficial mycosis. And in this lecture number 3 on fungi, we are going to discuss about the deep mycosis and candidiasis, mycotic poisoning, and opportunistic infections caused by fungi and management of fungal infections. Deep mycosis, otherwise called as deep-seated or systemic mycosis. So they are the deep mycotic infections. So they exclusively affect the subcutaneous tissues. So subcutaneous or intermediate mycosis, otherwise called as. Some of the examples here, they are subcutaneous mycosis. They are mycotic mycetoma, chromoblastomycosis, sporotrichosis, rhinosporidiosis, subcutaneous phycomycosis, and other systemic mycosis which come under this deep mycosis. They are cryptococcosis, blastomycosis, paracoccidioidomycosis, coccidioidomycosis, and histoplasmosis. These are the groups of fungal infections which come under deep mycosis. Let us discuss one or two examples of deep mycosis here. The examples of deep mycosis here. So mycetoma. So it is one of the example caused by fungus which comes under deep mycosis. So they are the chronic, slowly progressive infections. So mainly of subcutaneous tissues, usually of the foot, rarely of other parts of the body. So mainly the infections are seen in the foot, mainly of subcutaneous tissues, and chronic infections, they are slowly progressive. So mycetomas, they are. Etiology is the fungus. So mainly the disease was originally reported by a gill from Madurai in South India, Tamil Nadu. So and Carter established its fungal etiology. So they have discovered the fungal etiology for this condition, mycetoma. So it is therefore commonly known as a Madura mycosis, Madura foot, because originated the person Gill who identified this condition originally. So first time, so it is called as Madura mycosis or Madura foot. So this condition had been referred to as a Atharva Veda, as Padavalmiki, foot until. So in olden days, they have called it as Atharva Veda. In Atharva Veda, they called Padavalmika. So foot until it is. So it is seen mainly in the tropical areas. Occasional, very rare cases. So they have been reported from the temperate countries. So incidence varies markedly from one place to another place in India itself. You find this more in Tamil Nadu, so very rare in Kerala. So they are caused by a number of actinomycetes and filamentous fungi. So mycetomas, they are caused by many group of actinomycetes and filamentous fungi. So similar condition called Botryomycosis. It is caused by Staphylococcus aureus and some other bacteria. They cause Botryomycosis. So etiological diagnosis therefore is the important in treating the condition. If it is because of Staphylococcus aureus, you can use antibiotics. If it is because of fungi, you need to use antifungal. So mycetomas, they are mainly caused by number of actinomycetes and filamentous fungi. So in that case, you need to recognize what is the cause, whether it is bacteria or fungi. So for the particular treatment, perfect treatment. So the causative agent, it enters through the minor injuries. So whenever the person meets with the minor injuries in the foot, so this causative agent, that is fungi, that is actinomycetes, filamentous fungi, it enters into that injury and enters the body. So usually begins as a small subcutaneous swelling in the foot, and then it goes on enlarging. So it enters deeper and deeper tissues, enters into the deeper and deeper tissues, tracking to the surface as a multiple sinuses. So there will be a small openings at the skin, but the fungi, they are entering deeper and deeper. So there will be a discharge. Zero purulent fluid discharges will be there in that sinuses. So microcolonies of the etiological agents, they can be demonstrated. If you take out the specimen and observe in the microscope, you can find out the filamentous structures, that is fungi. The color and consistency of the grains, they vary with the actinomycetes. Mycotic mycetoma. So they are very commonly causing infections. So actinomycotic lesions, they may respond to the sulfonamides. So they can use sulfonamide antibiotics to treat the actinomycotic lesions. So mycotic lesions are resistant and may require amputation. So that is the difference. So this is about mycetoma. So next example here is sporotrichosis. So it is caused by the fungus Sporotrix skenki sporotrichum. It is characterized by development of the skin and subcutaneous lymph nodes. There will be a formation of nodules. So soft nodules in subcutaneous tissues and lymph nodes. You can find the nodules. So they break down to form indolent ulcers. So these nodules, they break down and they become ulcer like. The fungus is a saprophyte, so it depends on dead and decaying material, so found widely on plants, thorns, and timbers. So when the person gets a prick from the thorns, so this fungus enters into the body. So thorn pricks and minor injuries also, the fungus enters into the body. So then the fungus starts spreading from the primary site, that is through the lymphatic system. So it enters into the body, regional lymph nodes, and then it starts entering into the upper limbs, and it infects the tissues all over the body. So it is seen as a cigar shaped yeast cells without mycelia. So this Sporotrix skenki, it is not having any mycelia. It is a cigar shaped yeast cells without any mycelia. Filaments are not there. Sometimes asteroid bodies are seen in the lesion, composed of central fungus cell with a eosinophilic material around the center, so radiating from the center. So this is about sporotrichosis. One of the example comes under deep mycosis. So next let us discuss about the opportunistic systemic mycosis. As I told you earlier, so some of the fungus which are present around us, they are not having any virulence, that is they don't have any capacity to cause infection. Because of the compromised immune state of individuals, they start acting as a pathogenic fungus. So some of these saprophytic fungi, so they start acting as a causing some diseases. Aspergillus, Penicillium, Mucor, Rhizopus. So they are some of the fungus. They cause infections. Aspergillosis example we can take. So it is a commonest mold seen on damp bread or almost any other organic matter. They start growing aspergilli. So around 300 species are there. Among them, Aspergillus fumigatus. It is highly pathogenic in birds, and occasionally it may cause disease in human beings also. So they are some of the few species. They can cause opportunistic human diseases. Commonest human disease caused by Aspergilli is automycosis. Automycosis. So that pulmonary aspergillosis and disseminated aspergillosis, they are two types. So pulmonary aspergillosis, again Aspergillus asthma, and bronchopulmonary aspergillosis and colonizing aspergillosis. So these are some of the complications caused by aspergilli. Penicilliosis, it is a species which is very rarely incriminated in opportunistic human infections, actually mainly HIV infection. The people who are suffering from HIV infection, their immune system will be down. This Penicillium marnefii, so that starts causing infections, which is noted in the Southeast Asia. So then is Mycosis. It is an invasive disease which is caused by phycomycetes. So mainly by species Rhizopus, Mucor, and Absidia. It is used to be rare terminal complication, uncontrolled diabetes. The people who are suffering from diabetes, even HIV infection, or any other people who are taking steroids or cancer treatment, so their immunity will be compromised, and these mucormycosis starts appearing among them. Species such as Rhizopus, Mucor, and Absidia, they start causing infections. So that is mucormycosis. So next examples of opportunistic infections, fungal infections, they are automycosis. So auto is something related with ears. Automycosis, it is a fungal infection of the external ear. So external ear, there will be a growth of the fungus that leads to an infection and complication that is known as automycosis. It is very common disease and is usually caused by a species of Aspergilli. Aspergilli niger, Aspergilli fumigatus, and Penicillia also. So they all can cause a infection in the ears, external ear. The symptoms are itching, pain, deafness, and secondary bacterial infections may start appearing because that favors the environment for the growth of the bacteria. That is very common. And Pseudomonas and Proteus, they are the bacteria, they start growing in such an environment. So that leads to a formation of the pus, suppuration, and diagnosis can be made by demonstration of fungi in the scrapings from the ear. You can take a scrapings from the ear and you can conduct a study on that specimen. You can recognize fungal infections. And then next one is oculomycosis. It is a fungal infection of the cornea of the eyes. So mycotic keratitis, it is usually corneal trauma. Whenever the people suffer from the injuries to the eyes, corneal injury takes place, then the fungus, they start colonizing in the eyes, and they initiate the inflammatory reactions that leads to a ulcer formation and some infection of the eyes. So if it is not recognized in an early stage, if it is not treated properly, it may lead to the loss of vision, and the eye needs to be removed. And the widespread use of corticosteroids, steroid eye ointments, and eye drops, if it is used for a long period of time, it leads to fungal infections. It is more prone, it makes the person more risky. So next is many saprophytic fungi, they can cause ocular infection such as Aspergillus species such as Fusarium, Candida albicans. They are often responsible for the oculomycosis. They can cause fungal infection in the eyes. So diagnosis may be made by examining the deep scrapings from the eyes under microscope. You can see that fungal growth in the you can observe that in microscope, and you can treat this infection by using local application of amphotericin B, nystatin, and pymaracin. So natamycin it is. So antifungal cream, eye drops can be used to treat the fungal infections, especially amphotericin B, nystatin. They are very useful. Candidiasis, otherwise called as Candidiasis or Moniliasis. So it is an infection of the skin mucosal layer, and rarely it may cause internal organ infection. So as we discussed, it acts as a bridge between superficial and deep mycosis. So very rarely it can cause deep mycosis. So anyway, we are going to discuss this candidiasis. You can consider it as a bridge between superficial and deep mycosis, because very rarely it leads to infection of the internal organs. So Candida albicans is an fungus which leads to candidosis. It is ovoid or spherical budding cell. It produces pseudomycelia both in culture and in tissues also. It causes pseudomycelia, and they are normal inhabitants of skin and mucosal layer of human bodies. This candidosis, it occurs as an opportunistic endogenous infection. Because the organism is present normally on the skin and mucosal layer of the human beings. So when the immunity goes compromised because of some diabetes or HIV infection or any chemotherapy during cancer, so these Candida albicans, they start causing infections. So it is called as opportunistic infection, opportunistic endogenous infection. So mainly this diabetes and cancer and people who are on steroid therapy, so they predispose this condition. So predisposing factors are diabetes or compromised immune state. So cutaneous candidosis, it may be intertriginous or paronychial. So there will be a eczematous skin eruptions will be there, irritating. They are irritating, somewhat painful. So there will be a eczematous skin eruptions around the nail and even on the skins. So the former is an erythematous scaling or moist lesion. So that is intertriginous or paronychial. So this cutaneous candidiasis may be intertriginous or paronychial. So if it is intergenous, there will be a irritating eczematous skin eruptions will be there, scaling. There will be a peeling of skin is seen. So moist lesion with a sharply demarcated borders will be there, and papillar lesions are most prominent. The sites affected are the sites in the body where perspiration will be more, such as groin, perineum, axilla. So even below the breasts, paronychia and onychia. They are seen in occupations. The people who are working with the water, they need to immerse their hands into water for a long period of time. So they suffer the infections around the nails. And then common mucosal lesions, they are vaginitis, characterized by acidic discharge and found frequently in the pregnancy. During pregnancy, the woman suffers from vaginitis. There will be a discharge, acidic discharge from the vagina. And even oral thrush, it is seen among the infants who are fed by the bottle feeding. So those babies who are bottle fed, they suffer from oral thrush. There will be a white patch on the tongue. If you remove that white patch, there will be a oozing surface, red oozing surface, which is seen on the tongue. That indicates oral thrush. It is because of Candida albicans. So bottle feeding is not good. So everyone should avoid bottle feeding. So then next is intestinal candidosis is also seen. Very rarely Candida albicans causes infection of the internal organs. In that it is intestinal candidosis. So there will be because of oral antibiotic therapy, so which present as a diarrhea which is not responding to treatment. The people who are using broad spectrum antibiotic for long period of time, they suffer from diarrhea which is not responding to any other kind of treatment. So and even bronchopulmonary candidosis, that is also seen. So it affects the lungs. So pre-existing pulmonary or systemic diseases make the candidosis, bronchopulmonary candidosis. Then systemic infections such as septicemia, endocarditis, meningitis, they also may occur as a terminal complications in severe generalized diseases such as leukemia, and in persons who are suffering from immunosuppression. The people who are having immunocompromised state, they may suffer from systemic infections due to Candida albicans such as septicemia, endocarditis, meningitis, and all other complications which may lead to death of an individual. And Candida granuloma and chronic mucocutaneous candidiasis, they are very serious manifestations of a Candida albicans infection. It occurs due to immunodeficiencies. So this is about candidiasis or moniliasis, or otherwise called as candidosis. So management of candidosis mainly includes removing the predisposing causes. Which are the causes? So try to remove that cause. It corrects on its own most of the times. So but there are some chemical drugs which are effective in controlling the fungal infections. So mainly here it is nystatin. So nystatin is a drug which can control the fungal growth, and it can control the fungal infections, but it is poorly absorbed from the intestines. So when you take it through the mouth, it poorly absorbs through the intestines. So that is why it is of no use in systemic diseases. So local application you can use. If it is superficial infection due to some fungi, you can use it in the form of cream. So but if it is a systemic disease, you can use amphotericin B. Injections are very costly, so they can be used for the fungal infections, amphotericin B, and 5-fluorocytosine and clotrimazole. So they are a group of antifungal drugs which can be used to control the fungal infections. Clotrimazole you might have seen. If you are suffering from fungal infections, they give clotrimazole very commonly with some steroids, beclomethasone or dexamethasone, something mixture of clotrimazole and dexamethasone or beclomethasone. So you can see that Candid B cream, Candid B, clotrimazole plus beclomethasone. So that is a combination of antifungal drug and steroids. They give for fungal infections. They can control fungal infections. Another infection caused by fungus, Rhinosporidium seaberry. Rhinosporidium seaberry, which is found in stagnant water or aquatic life. So if there is any stagnant water there, the fungus is growing. That is Rhinosporidium seaberry. So that causes some chronic granulomatous disease, which is characterized by the development of friable polyps. So usually they are seen in nose, mouth, or eyes. Eyes, mouth, and nose. There will be a polyps, a friable polyps will be there. So that is caused by a fungus, Rhinosporidium seaberry. So it is very rarely seen in genitalia also, mucous membranes of the genitalia. So it is first time identified in Argentina, but it is very commonly seen in India and Sri Lanka also. So this causes some lesions in the nose, mouth, and eyes. So next, let us discuss about the mycotic poisoning. Some of the fungus they act as a poisons and they are very harmful for the human beings, animals, and all other birds and all. So such fungi which are poisonous substances. Let us discuss here now. Mycotic poisoning is of two types actually: mycetism, in which a fungus which is eaten for itself causes a toxic effects, and mycotoxicosis in which fungal toxins contaminate some articles of food. So the fungus which is eaten, it acts as a poison. So that is one type. And mycotoxicosis which contaminate the food items, and the food which is eaten by the human beings get a poisoning. So they are of two types. And mycetism has been known from ancient times. Several varieties of poisonous mushrooms. So we get here in our hospital people who eat mushrooms and they come with a nausea, vomiting, loose motion, abdominal pain, and all. Food poisoning they start getting. So poisonous mushrooms, which can take the life. It may lead to death also. Mycetism may cause gastrointestinal disease, dermatitis, and even sometimes death also. So hallucinogenic agents such as D-lysergic acid, so D-lysergic acid and psilocybin, they lead to hallucinosis. So they lead to hallucinations. So there are some group of drugs which are uh, used to control some of the symptoms. So they are produced by psilocybe. So psilocybe species of a fungi. So they are nowadays, they are in recent years they are getting some attention. So the best known mycotoxin, so mycotoxin, aflatoxin, so which is produced by Aspergillus flavus. It is frequently present in a moldy foods, particularly in groundnuts, corn, and peas. So they are highly toxic to animals and even birds and human beings. So the people who eat such a contaminated corn, peas, or groundnuts, so they may die, even they may get some disturbance. So they are so very very toxic, and it can cause hepatomas in ducklings and rats. Hepatoma means growth of tumor in the liver, and its possible carcinogenic effect in human beings also. It may lead to cancer among human beings. So there have been several reports of aflatoxicosis in India involving human beings and animals. Ergotoxicosis, it is due to toxic alkaloids produced by the fungus Claviceps purpurea while growing on the fruiting heads of a rye. So this is about the poisoning caused by fungi, mycotic poisoning. So this completes our fungi.